Current pulse oximeters are a non-invasive way to measure the amount of oxygen present in the blood by measuring the amount of infrared light that passes through a finger or ear. Oxygenated blood absorbs more infrared light than deoxygenated blood, indicating the presence of more oxygen-carrying hemoglobin. The more light absorbed, the more oxygenated blood is present. The average level of oxygen in healthy individuals is around 95%, with levels below 92% indicating potential hypoxia and dangerously low levels of oxygen. Pulse oximeters are primarily used in monitoring the health of individuals with conditions that affect blood oxygen levels, such as asthma, lung cancer, or pneumonia. In recent years, with the increased need for blood oxygen level monitoring due to the COVID-19 pandemic, pulse oximeters have been the gold standard for clinical and at-home use, as they are cheap and easy to use. Low readings of blood oxygen levels of less than 92% are a prime initial indicator of COVID-19 infection, even before other symptoms appear, with levels of less than 85% indicating a need for a ventilator. This makes pulse oximeters a possible life-saving device. However, current pulse oximeters can give falsely elevated readings in patients with darker skin pigmentation as much as 12% of the time. This means that if an individual with darker skin is in a state of hypoxia, the pulse oximeter reading will show levels anywhere up to 8% above actual levels. According to previous research, one of the most likely reasons for this is due to the color of light used in pulse oximeter designs being more readily absorbed by darker pigmented skin than lighter pigmented skin. The data used in the design of pulse oximeters comes from primarily lighter skinned participants, as only 6% of U.S. participants in research in 2011 were of African American or Hispanic descent, despite making up nearly 28% of the U.S. population. This means that pulse oximeter sensors and the type of light used in their design are potentially skewed towards lighter-skinned individuals, which could affect sensor readings for those with darker skin. This issue not only brings to light the lack of diverse data in research, but that these inaccurate pulse oximeter readings could mean the difference between severe and even life-threatening consequences or early intervention with a return to full health. To test the disparity in readings, our team performed a series of tests using a pulse oximeter and Bitolino device to measure blood oxygen levels during two different scenarios. First, breathing normally, and second, hypoventilating to simulate low blood oxygen levels. During both scenarios, blood oxygen levels were measured for 5 minutes with a bare hand, wearing a clear glove, and wearing a glove colored black. Across tests for all participants, the same trend could be seen with averages in minimum oxygen levels during artificial states of hypoxia being lower in almost all tests done with a colored glove. As you can see here, blood oxygen levels while wearing the colored glove were higher than with and without the clear glove. This shows that there was nearly a 2% difference between the colored glove and the other tests, which can be dangerous as the difference between normal blood oxygen levels and potential hypoxia is only around 3%. This trend clearly indicates a discrepancy in readings when a colored glove is worn during testing. To address this problem, our team developed a pulse oximeter design that adjusts the intensity of light passing through the skin using a color-sensing photoelectric sensor connected to an Arduino. The sensor measures the skin pigmentation and determines the correct intensity of light needed to provide accurate pulse oximeter readings. The photoelectric sensor sends data to the Arduino based on the skin pigmentation, which then increases or decreases the intensity of infrared and visible light used by the pulse oximeter. Ultimately, we hope our design will contribute to bringing equity to biotechnology and improve the level of care for all people, regardless of skin color.